It's day 3 of the latest Kilauea eruption, and the biggest concern continues to be the fog or the hazy conditions, which is a health hazard. And joining us this morning with what you need to know is Dr. Brent Tatsuno, pulmonary and critical care medicine at the Queens Medical Center. Good morning, doctor. How are you doing this morning?
I'm good. How are you?
I'm doing excellent. Now, first off, what are some of the concerns when it comes to fog?
You know, with fog, the easy way to think about it is it's volcanic smog. So a lot of the issues are going to be with breathing, with the throat, the nose, and the eyes. In general, fog contains a lot of sulfur, and that turns into sulfuric acid, and that's what's really irritating to all of those areas of the body.
Now, is there a specific group of people that it affects more, people with asthma, or does it affect everyone in general?
So actually, it can affect anyone in general. Those with asthma, COPD, underlying lung conditions, even ear, nose, and throat conditions are going to be affected just a little bit more than the average person, but everyone can get affected by it.
And what are some of the symptoms of fog? Like if people are out there, they see the hazy conditions, what are the symptoms that they can experience?
I think the most common symptoms of fog are going to be things like itchy or irritated eyes, an irritated throat, even sometimes mucus buildup or burning in the throat, an itchy or scratchy nose, and then definitely the big ones are going to be shortness of breath and cough. So again, that's why the patients with underlying lung disease are going to be affected just a little bit more.
And if someone is experiencing those symptoms, what are some ways to help alleviate some of the reactions?
I think just in general, trying to use common sense, I guess. With fog, you definitely want to try to stay away from it. So that means staying indoors, closing up the windows. If you're lucky enough to have an air conditioner, you go ahead and run it because it contains air purifiers, which will filter the air. Other things, you always have your primary care doc or even your lung doc that you can get help from. And at worst case scenario, don't be afraid to go to urgent care or even the ER because it's always better to be safe than sorry.
At what point, doctor, should you decide, okay, I need to call my doctor or I need to go to urgent care?
You know, I usually tell people use your gut feeling because you know your body better than anyone else. Definitely if you're having a hard time breathing, if your throat feels like it's closing up, those types of things, that's when it's time to seek help. You can always start with your primary care, but at worst case scenario, just go to the ER.
And you talk about using common sense in terms of staying inside, running your air condition. But if you do have to go outside and you see the hazy conditions outside, is it okay to maybe, would wearing a mask help? I see that on the East Coast with those wildfires. Would wearing a mask help?
You know, it's interesting you bring that up. The East Coast wildfires are definitely more carbon-based because it's a lot of green material, whereas fog is sulfur-based. If you look on the internet, they have these things called fog masks, which are similar to the KF94 masks. They haven't been vetted, but they are advertised as something that can help with the fog. So using a mask, a good fitting mask, it's not going to hurt you, and it might even help.
All right, there you have it, Dr. Tatsuno. Appreciate your time and effort this morning. Some great insight. You have a wonderful day.
Thanks, you too. Take care.